Welcome to Almost Here, Round the Corner Future Technology Podcast with Richard Jacobs. Future technologies poised to transform our lives for better or worse are the focus of this podcast. Almost here means these technologies are now here and starting to be used, or just around the corner, from Bitcoin to artificial intelligence, 3D printing, blockchain, virtual reality, and more.
Coming to Dallas, Texas, September 14th, 15th, and 16th, 2018, the Blockchain and Future Tech Expo. This is going to be a gigantic conference of over 5,000 people. We're going to be talking about blockchain and its applications. We're going to be talking about quantum computing, cybersecurity, artificial intelligence, and several other future technologies that are poised to and actually changing our lives as we speak. Here's why you should attend. As you may know, early adopters are the ones that investigated and profited from things like the gold rush in the 1800s, from the dot-com boom in the 1990s, from the internet boom in 2005, from the smartphone explosion in 2007, from the real estate boom that ended in 2008, and of course, from the Bitcoin boom that started in 2012. Early adopters act now. They don't wait till later. They go out west first. In their covered wagons, they find the biggest gold nuggets. If you consider yourself an early adopter and you want to find the biggest nuggets, then you owe it to yourself to attend this upcoming conference. Blockchain is going to affect how we control and store our medical data, how we send money around the world, how we bank, and more. But artificial intelligence, quantum computing, and cybersecurity will play a pivotal role in our lives as well. And that's why our next event, September 14th to the 16th at the Dallas Convention Center, is going to have not only 5,000 plus attendees, but will showcase blockchain, AI, cybersecurity, quantum computing, and more. You want to get in on the coming gold rush of future tech and opportunity as an early adopter. Don't be left out. To register, go to bftexpo.com. That's blockchainfuturetechexpo.com. Thank you. Hello, this is Richard Jacobs with the Future Tech Podcast. My guest is Mark Katakowski, the Chief Science Officer, President and co-founder of Forever Labs. Mark, how you doing?
Hey, Richard. Good. How are you doing?
Yeah, thanks. Thanks for coming.
Thank you.
So tell me about Forever Labs. What do you guys do?
Yeah, so what we do is, in short, is we bank your stem cells in the effort to make you live healthier longer. And what that is we cryopreserve your stem cells in your youthful state so you can leverage them throughout your life to practice what we like to think of as health maintenance or health maintenance medicine.
Okay, so if I bank my stem cells, what does that mean, health maintenance medicine? Like if I break down, you repair me in various ways? Or? Yeah,
so here's the thing. So 17 years ago, I've been kind of a stem cell biologist for the last 17 years. And 17 years ago, I worked in a lab where we were the first lab to use a stem cell called the bone mesenchymal stem cell to treat stroke in animals. And we found that these cells had this really actual potent therapeutic potential. They promoted the healing of animals that suffered stroke. And that work, kind of other people did the work and got similar results, and other people took it to other diseases. And now here we are, 17 years later, and this mesenchymal stem cell is actually in several hundred clinical trials being used to treat everything from stroke to heart disease and osteoarthritis and mostly age-related disease. But what we kind of found, and I personally, experienced in my research along this path, was that as you get older, and this happens in animals and humans, as you get older, the number of the cells that you have in your body decreases, and the quality of them decreases. And
of stem cells.
Yeah, of the stem cells, right. And so
okay.
what really, is kind of our core value proposition is that you can, bank these cells young in a youthful state, an effective state, because they're going to be at their worst when you need them the most. And so that technology, cryopreservation, has been around for many decades, and we're quite good at it. We actually can even freeze embryos and then actually thaw them and have whole real entire people generated from frozen embryos. So the technology's been there, but so I have to say though that the treatment of age-related diseases is, I think, extremely interesting, a good use of these cells. But what really got me out of the lab is that I think there's even an even better use where we can get even greater gains, and that's actually to use the cells as themselves to replace that which is lost to age. And so we call that, stem cell replacement, or when it's like young to old, that's called, heterochronic transplantation. Like in 2012, I wrote a couple grants to this effect and didn't get those funded. But a couple other researchers around the world did similar work where they're doing this young to old, young cells, transplanting these cells to older animals, and found it improved their health and their lifespan. And so,
but only stem cells, right?
Yeah, only stem cells. And actually, in this case, these mesenchymal stem cells, which is just one of the kind of stem cells that we bang.
I guess you could say in this business, the best time to get this done is today or yesterday, right?
Yeah. Yes. I mean, so ideally, you bank when you turn 18. It's like you get your graduation present or something. You bank. But the thing is, there's this decline that starts somewhere in your early 20s that you can start to pick it up. It's a modest decline in their number and function between 20 and 40, but then it increases, the rate of the decline decreases with age. I mean, increases with age, such that, the older you get, the faster they actually are going to pot. So really, the best time is today. The best time is when you're 18, but the next best time is today.
And, is there a limit where you're too old and it really won't do anything for you, or no?
I mean, so that comes down to kind of like ROI, right? So my mother is 70, or she's 71, but she banked when she was 70, and she knows that her 7-year-old cells aren't as great as like mine that were banked when I was 40, but she said, well, her mom lived till she was 93, and her mom, her aunt lived till 105. So she's like, well, maybe in 10 or 15 years, I'll want to have these. And so she decided. But we kind of, once people start to get up in their later years, we say, we'll just consider like, the investment, the ROI, knowing that, there's been a decline, but it's obviously the decline continues. There's actually, go ahead.
Can you culture them? Like if you get like 1,000 stem cells from me and I'm 70.
Yes.
Can't you culture them and create like 10,000 of them and then re-inject them into me and it still have a good effect?
Yeah, actually, so that's a really good point. And there's something this is a little bit more of why we wanted to start this company, why I wanted to do this was like, so not only can we expand the cells, and we can, for instance, like I've expanded my own MSCs, just some out of curiosity, and, I have more outside of me than I have inside of me just because we can expand them, exponentially. And we're getting very good at doing that without kind of burning the cells out. But at the same time, so there's technologies that are, coming down the pipeline, some of which we're actually working on ourselves, that you can kind of, to some degree, roll back the clock a little bit on the cells. Now, there's things that like DNA damage, there's certain kinds of damage that are going to be very, very difficult to reverse, almost intractable, but there are types of ways that the cells degrade over time that with the right cues, you can kind of get them to pick up the slack and get back into shape. And so when you expand them, you can possibly get them to a more useful state during that expansion. And those technologies are typically much more easily applied in vitro, like in a cell culture, than applied to a whole body, often because of like cost or targeting or dose. Those are often limiting factors. It's, like safety. But when you do it to cells outside the body as you grow them, you can do it at much higher fidelity, much lower cost. And so that's also part of like the interest. Not only could I take my mom's 7-year-old cells and grow more that are 70, but maybe as we grow them, we can tweak them a little bit, rejuvenate them somewhat, and then maybe they're more like 60-year-old or maybe even like 55-year-old cells. So she can actually like give almost like a young to old transplant. And that alone.
Are certain people similar enough that you can do a stem cell transplant, or you can only have your own cells? Yeah,
so the answer is like, a bit complicated. The short answer is, if you want to replace tissue, you need your own cells. That's not to say that there isn't any donor, applications with, say, the mesenchymal stem cell. The mesenchymal stem cell is the one that, it's like right now, gets all the therapeutic interest because they modulate regeneration and inflammation. So there are some trials where they're using like allogeneic, other people's cells. The problem is, what's come to light is that those cells don't stick around very long at all. They do not elicit like a strong immune response, but your body does find them and weeds them out within a few days. So you can get some kind of like short-term benefit from them, but you can't get, a long-term lasting benefit. You can't replace tissue. There's actually been some work in horses, actually, a veterinary like space kind of leads all of this in a lot of ways, where they found that not only do these like donor cells get wiped out, but if you use them a second time, much like a bee sting or something, you can start to your body raise its defenses against them, so they'll respond much more quickly and wipe them out much more readily than the previous. So I mean, you are your best donor.
There's no possible allogenic donors for this kind of cell.
It's
not even like
no, it hasn't been found
or anything.
No. So like it's even there's such a thing as called like an HLA match. You've probably heard of this bone marrow donation. You look for a perfect match, right? These are these alleles in this. There's a part of your DNA that contains, that produces proteins that are related to cells, and so when you're in a bone marrow donation situation, what they're doing is like they're taking these hematopoietic stem cells, they throw in to build your blood and immune system, and they're replacing yours with the donor cells. Before you get the donors, even this quote unquote like perfect match, you'll wipe out your own immune system with chemotherapy. Then you take in this donor, and then you generally are on immune suppressants to keep that donor immune system from attacking your tissues, your organs and stuff. Even though it's a perfect match, you're not really perfect. So yeah, it's the short of it is like you are your own best donor, and we can't just simply go in and cut out that part of the DNA that makes this cell line universal, because that part of the cell line, that part of the DNA actually plays other important roles in infection and actually immune function. So it's not very simple at all.
Okay. I should have asked you earlier, what is a mesenchymal stem cell versus like a pluripotent stem cell? Or, what is it? And how is it made and all that?
So most of the stem cells in your body and in the adult are multipotent, meaning that they can become multiple tissue types. The pluripotent can become any tissue type. The mesenchymal stem cell, as far as like tissue replacement, it can become bone, cartilage, muscle, and some different connective tissue. But in addition to that, but that's not why that's only part of the reason why there's this great like therapeutic interest in them. They also are really powerful coordinators of their environment. So they secrete many soluble factors that potently affect the cells around them. And kind of the reason why they're so therapeutically attractive is because through these factors that they release in the environment, they will decrease unnecessary inflammation, they'll promote regeneration, recruit new blood vessel growth, and kind of accelerate the healing process. Yeah. And that's actually. Yeah.
How are they used in the therapy? You mentioned they're used for stroke victims, et cetera. Like, how do they work in the various therapies that they're used for? Yeah,
so it depends. So in stroke, when we started with animals, we're like, well, we're treating stroke, so we put it directly in the brain, and that seemed to help some. But then, so what if we just put it in their artery? Well, they go to the brain and do their thing, and we put them in their artery, and the animals did well. And then we said, well, what if we just do IV? And we did, and the animals did well, if not better. So we put them directly in the brain. And we started to look into this because, you got to figure out what's the mechanism and can you improve upon it. And we found only a small percentage of the cells that we injected in these mice and rats was going to the brain, but they were recovering function, to a great degree. And even interesting things like, even on the far side of the brain that wasn't injured, they're having increased, synaptogenesis, the production of like new synapses, like it's like other, compensating for function lost even more readily. And so we really started looking at this, and we found that these cells, most of them are not going to the brain. Most of them are going into like the bone, the perivascular space, even like the lungs and the spleen, and they're having kind of a global effect on the entire animal. And this is what kind of led me down this path, because I came to the realization that what we were kind of doing was we were actually giving an injured animal stem cell augmentation or stem cell replacement therapy, and by doing so, we were enabling them to heal faster. And so there are stroke trials where they are, injecting them directly into the brain. There's one at Stanford, actually, that's like in phase 2, and they've been getting some good results in that. But there's also a number of trials, like there's this one in South Korea, Samsung University, I believe, they are giving them IV to the stroke patients, and that's a phase 3 trial. And so, it depends on the approach and the kind of the logic of the clinician of what they're trying to, but they're often very effective just given intravenously, because they'll kind of hone to where needed, and then they'll start to go to work.
Well, so if let's say I bank with you and I'm 40 and 5 years, I come back 5 years from now, I'm like, hey man, can you re-inject them back into me or part of them? Do I need a medical need for me to get my own stem cells back into me, or can I just have them back? Or, what happens once I bank them? Are there only certain ways you can let me have them again?
So first of all, from a business perspective, Forever Labs is, when we bank your cells, we're doing it in a completely agnostic fashion. So we bank it in a clinical grade, FDA compliant biorepository. They're well taken care of, but what you want to use them for and when you want to use them, that's up to you. They're your cells, and you say, I want you to send them here, and we'll send them there. They're your cells. We are not, banking for a specific purpose. And we're not just freezing down like one chamber. We have multiple chambers, so you can pull them up more than once for different uses. But to answer the question, so about, when can you use them or how, my goal, and we're working on this, so we are doing the work in mice where we're treating older mice with younger genetically matched cells to kind of build the preclinical groundwork for this foundation to take this into humans, this stem cell therapy, to treat animals that to treat people that haven't had anything except for a declining stem cell population, and so with their own cells. My goal is to make that happen, within the next 2 to 3 years, is to get that underway. That's part of my role and my strategy goal with Forever Labs. I think that is one of the best uses for the cells, to actually just to replace the flaws. But if you have, go ahead.
Yeah, it seems like a protocol would be like one way to use it. I don't know if you'd call this an abuse or not, whatever. But let's say I want to bank with you, and every 3 years I say, hey, I want some portion of the ones I banked, and I'm going to inject them back into myself to kind of keep myself, to slow my aging. Would that work? Is that allowed? Or would I have to do that? You can't know about it or something?
Inside the U.S., it has to be, within the confines of under the auspices of a clinical trial. It has to be in a clinical trial if you're doing the U.S. So if you're growing the cells, actually, and right now as it stands in the U.S., if you're not, once the cells are frozen, or if you're growing them, then it's considered to be more than a minimum manipulation, and they say, that constitutes something that's a biologic drug, so it has to be tested. They're being used in many different indications in the U.S., but they're all within, a registered clinical trial. There are people doing them, using them, expanded cells elsewhere. And there's even some U.S. companies that have, kind of subsidiaries or collaborators elsewhere, and then they're doing this kind of stuff, these kind of treatments. It's an interesting space because, we're trying to, I think there's the FDA itself, which I think trying to figure out how do you regulate this? Doesn't need to be regulated. I'll tell you, as like a stem cell biologist, there's good ways to grow the cells and there's not so good ways to grow the cells. I think that it's important how they're grown, how they're expanded is very important and plays a big role in their effect. It's one of those things that, my goal is to do this stem cell replacement therapy within the U.S., to do it within a clinical trial. And because I think that in the end, that's going to have the most impact on the most people. It's going to be harder on our end, but it's something that, that's our goal, is to kind of, transform.
If it was allowed, what would you recommend for someone that, let's say they think they're healthy and they're just getting older? Would you recommend, again, it's not allowed. I don't even know if you can say the word recommend, but
I'm a scientist. So, I'm a scientist. So, first of all, I'm not a clinical doctor. I'm a PhD and an MD. So, but, for me, the reason why I'm doing the animal work is because I want to answer that question. I want to, and I can describe kind of what our intentions are in humans to better this question.
Sure.
So what we envision, and I'm working on putting this trial together, is a one-time injection. Somebody will get a one-time injection of their own cells, and we're going to look at biomarkers of aging in their blood, and look at them before they get this injection, and look at them after, and look and consider, the dose and the time after, and see what kind of an impact that injection has. And then when we get that, then we'll look at, well, what if we do a dose escalation? And then we'll look at
what?
We'll do a dose escalation, right? So maybe a typical dose of these cells might be 100 million MSCs given intravenously. And then, so we'll do a typical dose. We'll do 100 million, and we'll look at these biomarkers and see if they change. And if they do change, then we'll see how long does that change last. And then, if once we start to determine that, and we say, oh, look, 6 months after it starts to go down, or hey, this is fairly robust for 2 years or something, then we can start to have some better guidance on how often. Because I also do think that the effect is going to depend upon the age of the person that's doing it, and eventually, when you have a lot of people banking their younger cells, the effect is also going to depend upon the differential between the age the person is and the age of this their own cell that's being infected. So there's a lot of open questions. But it's the kind of thing that I think that it's not. These aren't. The one nice thing about the mesenchymal stem cell is that literally tens of thousands of people have been treated with expanded mesenchymal stem cells, their own mesenchymal stem cells, in treatment for heart disease.
In what circumstances and what happened to them?
Well, for these are generally in the realm of clinical trials for heart disease, stroke, even MS and osteoarthritis. There's really kidney disease, lung disease. There's been COPD. There are literally hundreds of these trials, and in these trials, there's often dozens, if not hundreds, of patients. And so the safety profile of MSCs, expanded MSCs, is pretty well characterized, and it seems to be extremely safe. So that's the one upshot that we think we're not, proposing something, risky in doing like an autologous intravenous injection of someone's own cells. That's been done, but typically done in somebody that's suffering from something other than just the decline of aging.
Well, again, what can you say about the clinical trials you've seen? Like, how much improvement is there? Is it dramatic? Are there any contraindications? What? I don't know if you could sum up all the clinical trials in a soundbite. What do you see?
In a soundbite, it's been good. So, and the reason why I can say that is because it's been very good. Because if you look at the amount of trials that are started every year, it just keeps increasing. In the last decade, it's just been kind of like a hockey puck graph of the amount of MSC trials going on in the world. And it's not, they're not doing it. That interest isn't narrated because there's no results. They're actually, and that's actually why, I was so motivated. I was turning 40 and I was like, I got to bank my cells. Like there's almost, I like to say it, like Forever Labs is a little bit of a midlife crisis.
Well, so, it sounds like a very smart insurance policy to do this, because over the next X number of years, there will be a lot of data coming out about it. And if you were smart enough to have done so, then you can take advantage of this and the benefits it has. And if you haven't, less of an advantage. Yeah.
We save money, right, with the idea of having financial returns over time. I think it makes a lot of sense to save biology, your young biology to get health returns over time. My cells, like I said, they're 40, and I'm 43 now, and every year that passes. Too. Oh, cool! Hey, and every year that passes, like my 40-year-old cells become that much more valuable to me because they're that much younger than I am.
Are you not that you would, but are you allowed to self-experiment and re-inject them back into yourself, or?
Well, I definitely intend to participate in a trial that we run as soon as I can. I'll have to be blinded though. I might get placebo, but eventually I'd like to get the actual treatment. That's my goal. I think that it's, we take a lot of stuff to try to keep ourselves healthy or try to restore health.
Yeah.
And a lot of the stuff that we take, some serious contraindications and some serious risks. And treating yourself through your own biology is probably one of the lower, on the lower end of the risk scale, in my opinion. That's just not a medical kind of statement, but it's my own opinion. I'm in time, I'm going to be doing it, that's my intent for sure.
In the clinical studies you've seen, are there any contraindications? Does anything go wrong, to put it simply, or it's just varying degrees of improvement or not?
Nothing that was, attributed to, hey, these cells did this. The MSCs actually, so, sometimes there's been talk of stem cells inducing tumors or something. Not with the MSCs. You get, they're really well tolerated. And in every trial there's always some people that, have some suffer something, but it's always difficult to tell exactly. But it doesn't seem to be a, hey, this is the contraindication for MSCs that you gotta look out for. If they're safely administered. But that is this, but I'd like to say that, so there's better ways to grow these cells than they're sometimes grown. And sometimes, they're just, these cells, before they're put in people, they're played in a flat plate, and they're grown in fetal calf serum, which is kind of a serum supplement to grow them. And that, they grow okay in that, but that's not ideal. It's not the best fit. And actually, there's been studies where cells grown, expanded to great numbers under those conditions can start to get an increase in mutations. And so then, you're doing damage to the cells that you want to use. So there are better ways to grow them. And, that's something I'm very interested in bringing, to the clinic too, is more appropriate and more effective ways to expand them without depleting them or damaging them in the process.
Right, so make sure you don't go to a place that grows them in Mountain Dew or something terrible.
Right. Yeah.
Okay, gotcha. So what's the process?
Sure.
If I want to now, can I get my mesenchymal stem cells banked with you, and how does it work and all that?
Absolutely. So we've been doing it for almost 3 years now. One thing that I didn't realize when we started this company was that orthopedic surgeons and sports medicine docs and physicians in that space have been aspirating bone marrow, collecting bone, and then concentrating it and injecting that concentrate into areas of injury or after surgery to promote healing. And the cells are in that concentrate. So we found when we started the company that there was this, kind of infrastructure. There were physicians that were very comfortable doing this and doing these aspirations. And so we actually partner largely with a lot of orthopedic surgeons, and they're great ones. I mean, our docs are like from Duke and Stanford and Michigan and Yale. And so we have these orthopedic docs, and the process would be like, you go to our site and you say, hey, I want to bank my stem cells. So I say, where are you located? Okay, I'm in LA, and then we'll connect you with, one of our physicians in LA. And you go there, it's the same day, you schedule and you go there and you do this collection. It's a 15-minute process. It's done under a local anesthetic. You get, and they take the bone marrow from, it's called the iliac crest. It's a little bump on your pelvis. I mean, so it's kind of like on your back. You lay on your stomach, and you can, and they draw it out. You feel like it's best described as just some kind of strange pressure as they draw, and it lasts a few, 5 to 10 seconds during the draw, and it's a weird feeling. It's not, it's funny. Like, we just had a client that described it to me recently. She said, it wasn't pain. It was just something I never felt before, and wouldn't want it to go on forever. But it was so short that it was like fine. I mean, like, literally, I'd rather do that again than have my teeth cleaned. And then you're done. And I walked across town after and had lunch with my wife.
And you were fine, no pain or anything, or soreness.
Yeah. And then so your cells go to our processing center. We process them in Ann Arbor, Michigan, and then we send them to our biorepository, which is in Franklin, Massachusetts, in clinical grade biorepository. And you get notification. You log on our site. It says, here's your cells. This is when they were banked. This is how much younger they are than you. And and then there's a button there. It says request my cells. So if in the future, whenever you need them, you can click that button and tell us, where. We'll get in touch with you right away.
Wow, so it's very interesting. How many cells do you take approximately?
We take 60 cc's of bone marrow, and so the amount of cells in there for MSCs, it's in the tens of thousands. It ranges between individuals and their age, but it's plenty to start cultures that can grow hundreds of millions of cells. You can get a near inexhaustible supply if you manage and expand them conscientiously. the as far as a volume, 60 cc's is not so much. So if you were giving like a bone marrow donation via that method, they take more than 10 times that much. And so that's one thing that people often ask too. They say, hey, if I'm taking some of these stem cells, am I depleting what I have? And then no, because we take about 3%, 4% of your total bone marrow. So about 3 or 4% of your cells need to divide once and it's replaced. Bone marrow donations are taking maybe about half of what you got. So, and there's no.
One second. You said you take about 3 or 4%. Does it get replenished? I didn't quite.
It does. Oh, it does immediately. Yeah, it gets replenished within a matter of like a week or two. As far as
all right, so really no harm to you at all.
Oh no, it's kind of like a blood draw. The physicians kind of refer to it as an advanced blood draw because it's blood. Yeah, they readily replace themselves.
Are there any times where you shouldn't have it done? If you have an illness or like, let's say you've had cancer or something like that, or let's say you've had certain treatments done, anything that says you shouldn't do it?
Well, so the aspiration is well understood by physicians, and so we always say, that is up to your physician. And if, of course, every one of our physicians always, ask for medical history and to find out this kind of stuff. And if there is something, then we always say, well, talk to your physician and go with a recommendation. It's typically considered to be a pretty minor, procedure. So there aren't, that many things that would preclude you from being able to do it. But yeah, there's a few, that may.
Oh, do you have an example of any of those things?
Yeah, I mean, we like, for instance, I would love to be able to bank anybody, whether they were HIV positive or not. But right now, we just don't have the facilities to do so. So we just can't get people right now. Yeah.
Okay, gotcha. Any other major contraindications where you really couldn't do it?
No, nothing that comes to mind right away. I'm sure if you had any kind of recently active malignancy, you don't want to. But that's really, like I said, I'm not a doctor, and we don't practice medicine. What we do is we, connect people that want to bank with physicians that do it, and then ultimately it's up to the physician to make those medical decisions. That's their domain.
And can you do this locally and send the cells to you, or do you have to go to like your center and do it?
So we're located. We've got I think now we're in 10 states. So we're
nice.
in New York and so Miami and Austin, LA, San Francisco. We're in a lot of places now. So it's getting easier and easier to find one of our docs, and we're growing. So yeah, you just go on our site, and you just like look at our map, and we'll show you where the nearest physicians are.
Okay, that's great.
Yeah.
So when do you guess you'll get into clinical trials and have some have a product where you can take the next step, where you can re-inject them back into people for certain indications or any indication?
I mean, my goal is to, this process takes time, whether it's, even when everything goes perfectly, it takes time. I would love to be able to, start finding out start doing these trials within a couple of years. I would love to, start enrolling, recruiting, patients within, maybe 2 years, 2.5 years. That's my goal. And it's really our aim to, do it in the most conscientious and informative way possible. So I think it's not there's a lot of, I would say, there's a lot of people sticking stem cells in people for anything. And, and then even when they do get a benefit, unfortunately, it's often anecdotal. All they get out of it is an anecdote, right? And what we're trying to get is hard data that can move the ball forward on this method of health maintenance. And so, part of the process is, getting the approval and getting, and getting this trial set up through all, through the regulatory and institutional kind of structures that you have to do. But the other is, I want to be very smart about it, and I want to get the most information we can out of it, because I do believe that we're gonna. I think it's worth doing, and I do believe that there's a very good chance of success. That's why we're doing it. At the same time, I want to get a lot of information out of it, so we can, take that information and then move the ball forward and really make a difference in the healthcare. That's ultimately our goal.
So what's the short-term horizon ideally is 2 years. What's a more realistic one, and then what's the one that's late?
I'll tell you what, I'm 43, and I don't want to turn 50 and not have my cells looking back in me. So that's kind of my own, personal goal. And so, we'll see. But we're going to make it happen. We're going to make it happen one way or the other.
Well, that's great. Okay. Are there any mesenchymal cells that can come from other spots versus bone?
There are.
Or is bone the best?
There are. So the bone marrow, the bone marrow has mesenchymal stem cells, but it also has hematopoietic stem cells, and we bank them both. We bank all the cells with nuclei, all the nucleus cells that are in the bone marrow. So, and the reason why is because the mesenchymal stem cells are extremely useful, and that's the first target that we're using for this replacement therapy. We bank bone marrow because you also have hematopoietic stem cells, which build your blood and immune system. And we think down the line that is a whole nother population that we can rejuvenate and by donation, by transplant. However, MSCs are found at a lot of places in the body. They're found around the vasculature. They're found in your spleen. They're found in your adipose, in your fat tissue. And it's not going to be very long before we are going to be offering actually the ability for people to get their mesenchymal stem cells out of fat tissue. So what's going on right now is a lot of people are doing liposuction for a lot of different reasons, whether it's, breast reconstruction or after, a mastectomy, or whether it's, there's like a lot of cosmetic grafting of fat, beyond just like kind of reducing, the amount of fat. And a lot of adipose tissue is just being thrown in the garbage. And so we are actually right now in the final phases of kind of launching a service where for people that are going to be, having a liposuction, they're going to have the option, hey, do you want to bank what's in there instead of toss it in the garbage? And so that's going to be another way that they can at least bank, they won't have their hematopoietic stem cells, they don't have their HSCs, but at least they'll bank their MSCs.
Is there any difference in the efficacy of adipose MFCs versus bone MFCs?
It's a very good question. From my own experience in the lab, once you're growing the cells for any extended period of time, the cells begin to reflect the culture conditions, and they start to behave more and more similarly. When you take them out of the body immediately, they kind of reflect the tissue that they were pulled out of. So I often get asked by orthopedics, because there's kind of a debate, hey, which MSCs, because they use MSCs for orthopedic applications. I often say, hey, what's better, bone marrow MSCs or fat MSCs? And I say, well, I don't know. And it's it could be either or. I'm not sure. Whether or not, and there's actually, that's the other thing too, not all, not all fat is equal and not all bone marrow is equal. As you get older, some of your bone marrow starts turning fatty, and some of it still remains blood making, and so where you took it from matters. And same with fat. Like fat, there's, you've got yellow fat and you've got brown fat, and they're not the same. So the MSCs within there might be different. But what we found that is when you start growing the cells in culture for an extended period of time, they start to kind of converge upon like a similar kind of phenotype or I guess that's the best way to say it. Yeah.
Okay, gotcha. Very good. So what's the best way to find out more about the process and maybe sign up, et cetera? What kind of resources can we give to listeners?
Yeah, so we're on foreverlabs.com, and just go there and you can just click Get Started, and you can find a doc. But if you want, to learn more, we have a form you can fill out, ask any questions you want, and or you can call us directly, and we've got awesome client liaisons or best people just will chat all day long and tell you all about what we're doing and why, and answer your questions. So yeah, go to foreverlabs.com, and that's the best way to get started.
Okay, well, very good. Well, I appreciate you being on the podcast, and it's interesting. I mean, we're going to be looking to you to see what kind of therapies come from this. So
thanks, Richard. I appreciate it.
Coming to Dallas, Texas, September 14th, 15th, and 16th, 2018, the Blockchain and Future Tech Expo. This is going to be a gigantic conference of over 5,000 people. We're going to be talking about blockchain and its applications. We're going to be talking about quantum computing, cybersecurity, artificial intelligence, and several other future technologies that are poised to and actually changing our lives as we speak. Here's why you should attend. As you may know, early adopters are the ones that investigated and profited from things like the gold rush in the 1800s, from the dot-com boom in the 1990s, from the internet boom in 2005, from the smartphone explosion in 2007, from the real estate boom that ended in 2008, and of course, from the Bitcoin boom that started in 2012. Early adopters act now. They don't wait till later. They go out west first. In their covered wagons, they find the biggest gold nuggets. If you consider yourself an early adopter and you want to find the biggest nuggets, then you owe it to yourself to attend this upcoming conference. Blockchain is going to affect how we control and store our medical data, how we send money around the world, how we bank, and more. But artificial intelligence, quantum computing, and cybersecurity will play a pivotal role in our lives as well. And that's why our next event, September 14th to the 16th at the Dallas Convention Center, is going to have not only 5,000 plus attendees, but will showcase blockchain, AI, cybersecurity, quantum computing, and more. You want to get in on the coming gold rush of future tech and opportunity as an early adopter. Don't be left out. To register, go to bftexpo.com. That's blockchainfuturetechexpo.com. Thank you.
You have been listening to Almost Here, Around the Corner Future Technology podcast with Richard Jacobs. Subscribe to this podcast, post a review to discover more future technologies that are poised to transform our lives for better or worse, such as Bitcoin, artificial intelligence, 3D printing, blockchain, virtual reality, and more.